namely that antidepressants often do not do what they promise and are in fact causing harm to many.
Dr. Steve Hotze is suing over Obamacare's employer mandate.
It's time for a wellness revolution. Brought to you by Hotze Health and Wellness Center. Honest discussion on maintaining health and wellness naturally to enjoy a better quality of life.
He's the doctor fighting to let you keep your doctor.
Now, Dr. Stephen Hotze.
Good afternoon, everyone. Thank you for joining us today at Dr. Hotze's Wellness Revolution. I'm Stacey Banfield here with Dr. Stephen Hotze. And who is Dr. Stephen Hotze? He is the founder of the Hotze Health and Wellness Center. If you have any questions for Dr. Hotze today, then you can give him a call. He's in studio, 713-212-5950. That's 713-212-5950. He is also on Facebook Live. So you can go to Facebook, type in Hotze Health. That's Hotze Health, and you can watch him on the radio program live. And finally, please remember to download those podcasts. You can go to Hotzepodcast.com. That's Hotze podcast.com. You can catch all of our radio programs, listen to them day or night. Super duper convenient. We're so glad you joined us today. And here is Dr. Stephen Hotze.
Thanks so much, Stacey, and thank each one of you for joining us on Wellness Revolution. And we hope you will join the Wellness Revolution and take charge of your health. Do a 180. Take charge of your health. I believe that you need a health coach. You need a physician and a staff of professionals who'll coach you onto a path of health and wellness naturally. Why? So you enjoy a better quality of life as you mature. Why should you just be, accepting of just feeling tired, fatigued, inability to think clearly, having brain fog, poor sleep, depressed moods, joint muscle aches and pains, sluggish bowels, recurrent infections, just in a wreck.
And just to be told that you're just getting older and to deal with it, that it's just part of being older.
That's why you need a health coach that's going to coach you onto a path of health and wellness naturally without using pharmaceutical drugs. Today we're going to talk about fibromyalgia and chronic fatigue syndrome. And we're going to, in fibromyalgia comes from a Latin term, from the Latin words fibrous, fibro, which means fibrous tissue, myo, which means muscle, algia, which means pain. So it's just muscle aches and pains. That's what it means in Latin, and it's a Latin term. So you go to the doctor and you tell him, "Doctor, I'm aching all over," and he does $1,000 worth of tests and tells you got fibromyalgia, and which is not a diagnosis. It's just redescribing your symptoms. So you should say, well, what does fibromyalgia mean? Well, it means joint muscle aches and pain. Well, that's what you told him. So you go in and tell the doctor you got joint muscle aches and pains. He translates it into Latin and says that's a diagnosis because he can code it on the CPT, the insurance code. And then what does he do? Your next question should be, Doc, why do I have it? Most people go, oh, my goodness, I've got fibromyalgia. What can I take for it? And what are they going to give you? Antidepressants is what they give you, Lyrica or Cymbalta. I want to tell you about Jennifer's story. Jennifer had visited her physician numerous times and had received various prescription drugs. And finally, her doctor just became totally exasperated at her coming in and complaining. He said, look, Jennifer, you're just going to have to live with this the rest of your life. She had joint muscle aches and pain. She was fatigued and tired. She had sluggish bowel function. She couldn't think clearly. She had poor sleep. She had weight gain. And he said, basically, you're just going to have to learn to live with it. Well, she was a young woman at the time and had always led a very active life. And after graduating from college, she moved to Arizona where she became a paralegal. In her mid-30s, she noticed that her endurance level at the gym was declining considerably. And for someone who worked every day and worked out every day and ran 6 days a week, she was concerned about it. She's in her 30s now. She had been doing this exercise for the last 10 or 15 years since she was in college, and now she just didn't have the endurance. She never thought about it before, but suddenly it became an issue to her, and she tossed and turned and would wake up more worn out every passing day. And despite feeling completely exhausted and fatigued, she just couldn't sleep at night. So Her symptoms worsened over the next 2 years, and other symptoms began to appear besides the insomnia. She had bone aching fatigue, muscle weakness, migraine headaches that were debilitating. Sometimes she couldn't even get to work. And she had a big change in her menstrual cycle. She was having excruciating menstrual cramping, and she gained weight. Her entire body ached, and from the joints in her hips to the muscles in her necks and shoulders, she was in constant pain. And she's just 34 years old. She was always also experiencing recurrent sinus infections, and she had chronic sore throats and allergies. She was just a sick person. She was sick and tired. She's 34, for crying out loud. Having been a very outgoing and social person, she began to decline invitations to going out or attend events. She barely had enough energy to keep going, and she had nothing left to give at the end of the day. And to make matters worse, her health obviously began to affect her job, and by the time she got to the work each morning, she was already exhausted. And she'd wonder how she'd make it through the next 8 hours. And she just suffered. Finally, she crashed. Her fatigue was so severe that she could hardly walk without becoming breathless. And one day, while sitting at her desk, hunched over, shaking, and feeling as if she were about to pass out, she realized that she couldn't keep going on like this. And she left her job that day and resigned, never returned. She was incapable of performing work. And by this time, she was 37. And as you can imagine, her future looked pretty bleak. The next day, she went to see her primary physician that she'd been seeing all this while, the one that said, you're going to have to learn to live with it, honey. And she planned out how she would once again relate her symptoms to him. Despite feeling worse than she had felt in her entire life, she was hoping, really beyond hope, and intently wishing that he would understand her predicament and diagnose the underlying cause of her problem. When the nurse roomed her in and asked her for the reason for her visit, she told her problems. Immediately, the nurse stated that she knew exactly what the matter was. Jennifer said, what a relief. When the doctor entered, he only allowed her to tell her story briefly. Without even questioning her further, he pronounced, Jennifer, you are depressed. What? Jennifer thought. He'd never mentioned anything about being depressed before, not even once. And she knew she wasn't depressed. She didn't feel good, but she wasn't depressed. She had good job, good life, good family. So the doctor handed her, at that point, a sample case of an antidepressant and sent her on her way and patted her on the back and said, this will make you feel better. She had been prescribed Xanax, antidepressants, and sleep medication before. None of them had solved her problems. She hated how the drugs made her feel. She didn't feel like being drugged and decided that she wouldn't take the antidepressant. At that point, Jennifer called her dad and said, I need to come back home to Houston. I'm going to tell you the rest of Jennifer's story when we come back.
And if any of those symptoms sound familiar to you, that bone-crushing fatigue, muscle aches and pains, maybe you've even been given an antidepressant and you're not even depressed, then give us a call because there is hope. 281-698-8698. It's 281-698-8698. You're listening to Dr. Hotze's Wellness Revolution. Please stay tuned.
Dr. Hotze's Wellness Revolution, your daily dose of radio reality.
And if you are sick and tired of being sick and tired and want to do a 180 today and take charge of your health, then give us a call at 281-698-8698. That's 281-698-8698. We'd be more than happy to give you a complimentary copy of Dr. Hotze's book, Hypothyroidism, Health and Happiness. It's the book that he's been reading from today. And also Dr. Hotze's latest book, Do a 180, Join the Wellness Revolution. Here's Dr. Hotze.
We've been talking about Jennifer's story. And Jennifer done very well in college. Grew up in Houston, did well in college, ended up moving to Phoenix where she did paralegal work and became extremely, in her early 30s, mid-30s, she became extremely fatigued. She couldn't think clearly. She couldn't hardly get out of bed. She couldn't sleep no matter how tired. She ached all over. She had just unrelenting pain. She had migraine headaches, and she ultimately had to quit her job, call her father in Houston and say, come get me. I just can't work. And this was when she was 37 years of age. She was unmarried, hadn't had any kids, and she had been a very active individual, had worked out every day, 5 days a week. She'd worked out since college, so for 12 or 14 years, and she couldn't do that anymore. She couldn't even hardly get out of bed. So she came back to Houston, and her symptoms continued to worsen. Of course, her parents were concerned about her and took her to numerous specialists in Houston, ran numerous blood tests. Of course, all the blood tests were normal. And even though she goes to the specialist, the walls are covered with all kinds of plaques and the degrees and everything, she noticed that the waiting rooms were filled with the sickest people she'd ever seen. Nobody seemed well there at these offices. So various doctors gave her various diagnoses. One of them was fibromyalgia. Another was chronic fatigue syndrome. Another was irritable bowel syndrome. And all they offered for her was more antidepressants and anti-anxiety medications. Now, does this sound familiar? Have you been, by the way, I saw a woman recently in our office, very recently. I walked in on this poor lady, and she was on 25 different medications.
25?
25 prescription medications. It was incredible. All kinds of medication, antidepressants, anti-anxiety, sleep medication, pain medication, medication for irritable bowels, blood pressure medications, 2 or 3 different types. And the woman was just a wreck, a total wreck. How do you put something like that back together? Well, this was the path that Jennifer was going down, and she was frightened, and of course she was very concerned about her future. She couldn't work. She's at home with her parents. She's 37 years old. What's going to happen with the rest of her life? Well, her family knew some friends that had been to a guest at the Hotze Health Wellness Center, and they recommended that she come in here and be evaluated. And she saw Dr. Ellsworth, explained to him his problems. Now, these sound like very common problems we see at the Hotze Health Wellness Center. The fatigue, difficulty with weight, brain fog, difficulty sleeping, mood swings, anxiety, panic attacks, joint muscle aches and pains, sluggish bowel function, recurrent and chronic infections, hair falling out, just doing irregular menstrual cycles. I mean, so she comes in with all these symptoms. Well, this is kind of classical for us. Despite the fact that her lab work was in a normal range, she had all the classical findings and symptoms of what? Hypothyroidism. And she had also the classical symptoms of imbalance in her female hormones. And she had problems with adrenal fatigue. So Dr. Ellsworth started her on a simple program. Let's get her eating lifestyle corrected. Let's get her on a good yeast-free eating program, paleo eating program, good fats, good vegetables, good meats, cut the carbs, cut the sugars, get on some hormone replenishment therapy, including thyroid hormone, and then get her on a good vitamin and mineral program to help her detox from all the drugs she's been on and all the other chemicals in the environment. And let's see how you do. Well, you know what? Jennifer did very well. Now, this goes back almost 15 years. And she's doing well, working full-time, and feels great about life. She's an awesome gal, bright, articulate, and the night and day difference. I can't imagine what would have happened if she would have continued down the path she was on and hadn't done a 180, or her family hadn't encouraged her to do a 180 and take charge of her health, and come to see us here at the Hotze Health Wellness Center. We see women like this, and men too, all the time. You know, if she'd have waited another 20 years, she might have been on 25 different medications if she was still alive. Well, we've talked about her diagnosis from her other doctors, fibromyalgia, which means joint muscle aches and pains, and chronic fatigue syndrome. All these are just labels. These doctors have labelitis. The question is, what causes these problems? And so prior to 19 1970 or 1980, there wasn't any diagnosis of fibromyalgia or chronic fatigue syndrome. People began to develop these symptoms, and so doctors wanted to find a label to put on all these symptoms. Now, the symptoms of fibromyalgia are fairly straightforward. Obviously, joint and muscle aches and pains, and morning stiffness, tingling and numbness in the hands, headaches, irritable bowels, brain fog, irregular menstrual cycles. You've got and chronic fatigue syndrome has basically the same symptoms, except you have to have an unrelenting fatigue associated with the symptoms. Both of these disorders, you have to have your symptoms for a minimal of at least 3 months. In chronic fatigue, you have to have 6 months of chronic unrelenting fatigue to be labeled. Well, the drug companies came up with a treatment for these disorders. What they have to do is they have to create a new disease category, which was fibromyalgia and chronic fatigue, and then they had to have a drug that they could get approval from the FDA to be used to treat that syndrome. A syndrome is just a constellation of symptoms. It's not a diagnosis. A diagnosis tells you the underlying cause of your symptoms. You don't wrap the symptoms up and say, well, all the people that have these symptoms, we're going to label it this. That's labelitis. Well, that's what the doctors end up doing. And the drug companies like that because now they've got a new disease disorder to treat and a new drug. So 2 drug companies, of course, came out with treatment for this. And they came up with the drug. It was both Pfizer and Eli Lilly. So Pfizer had an epileptic seizure drug called Lyrica, which they gained approval for treatment of fibromyalgia in 2007. Eli Lilly came up with a drug called Cymbalta, which was an antidepressant, and got FDA approval for treating fibromyalgia with Cymbalta. So now we're putting these people who have these syndromes on a chemical, a toxin, a pharmaceutical drug to treat their symptoms. And frankly, they have very little improvement because they don't treat the underlying cause. Now, what the drug companies like to do, what the drug companies did, was they promoted this disease to the public. And so they had here's what happened. Eli Lilly sales skyrocketed on the drug Cymbalta from $442 million in 2007 to over $3 billion in 2011. And in 4 years, they had dramatically increased almost 8 times their income that was generated. Lyrica did the same thing from $395 million to $3.4 million in 2011. And they were touted to reduce the pain of fibromyalgia. And as I mentioned, it was marginal results. But the side effects of these drugs included nausea, dizziness, weight gain, constipation, blurry eyes, trouble concentrating, drowsiness, swelling of the hands, feeling high, suicidal thoughts. And many of these side effects were already the symptoms of fibromyalgia. The real question is, what causes the fibromyalgia? What causes the underlying chronic fatigue? What's the underlying cause that manifests itself in these symptoms? Well, guess what the common feature is? Hypothyroidism. These are all the symptoms of low thyroid. Yet because doctors are enslaved to a blood value, a blood range, and if anybody on their thyroid study falls within this very, very wide range of normal, where 95% of the population fall, they say, well, it can't be thyroid, because they're not looking at the clinical symptoms that the patients are manifesting. Rather, they're looking at the blood test. And based upon the blood test, we don't have any diagnosis, so we're going to have to put all the symptoms that you have, which are all hypothyroid symptoms, we're going to have to put them together in a nice little package and bow, and we're going to have to give a name to it. So they created names for the symptoms of hypothyroidism that created two names, fibromyalgia, chronic fatigue syndrome. Now, who do you know that has joint muscle aches and pains? Who do you know that's been diagnosed with fibromyalgia? Have you? Family? Friends? How about chronic fatigue syndrome? Who do you know that's been diagnosed with that? We're going to come back and talk about how we make our diagnosis and how we would handle these problems here at Hotze Health Wellness Center when we come back.
If any of this sounds familiar to you and you would like more information, then give one of our wellness consultants a call today at 281-698-8698, 281-698-8698. We'd also love to give you a copy of Dr. Hotze's book where he discusses thyroid in more detail, hypothyroidism, health, and happiness. You are listening to Dr. Hotze's Wellness Revolution. Please stay tuned.
Why walk amongst the living sick when you can join a wellness revolution? Here's Dr. Hotze.
Welcome back to Dr. Hotze's Wellness Revolution. This is Stacey Banfield here with Dr. Stephen Hotze. And if you are sick and tired of being sick and tired, then know there is a natural way to address your health issues. You can give one of our wellness consultants a call at 281-698-8698. That's 281-698-8698. And of course, we're on Facebook Live right now. If you want to watch Dr. Hotze on the radio program, not just listen, you can go to Facebook, type in Hotze Health, that's Hotze Health. And then, of course, remember to download our podcasts, which are on hotzepodcast.com. Here's Dr. Stephen Hotze.
Thank you so much, Stacy, and thank each one of you for joining us. I'm talking today basically about the way conventional medicine, in concert with the pharmaceutical companies, creates syndromes for which the pharmaceutical companies create drugs so they can sell you a drug for your syndrome. Now, a syndrome is not a diagnosis, contrary to what doctor may say. Well, you go into your doctor and listen to these symptoms of fibromyalgia and of chronic fatigue syndrome. Obviously, fatigue, joint and muscle stiffness, sleep disturbances, headaches or migraines. You can't focus. You got brain fog. You have constipation or irritable bowels. You're bloated. You've got dysfunctional uterine bleeding. You got painful menstrual cycles. You have panic attacks. You feel anxious or you're depressed. You got dry skin. Your muscles are weak. You're fatigued, tired in your muscles. You have nausea. You got dizziness. You have sore throats, tingling and numbness in the extremities. You got cold extremities. You have memory loss. You feel short of breath. You have increased allergy symptoms. You have chemical sensitivities to certain fragrances and odors and to maybe even to the newspaper print. Blurred vision, sensitivity to light, weight loss or weight gain, chest pain, chills and night sweats, chronic cough. These are all the symptoms that are consistent with fibromyalgia and chronic fatigue. Now, you only need 3 or 4 of these symptoms and joint muscle aches and pains for 3 months to be diagnosed with fibromyalgia if your blood level's normal. To have chronic fatigue syndrome, you have to have unrelenting fatigue for 6 months with 3 or 4 of the symptoms that I noted. Well, now we've got all these symptoms that we put in a little box, and we wrap a bow around it, and we name the box fibromyalgia or chronic fatigue syndrome. When all these symptoms that I've described are symptoms of low thyroid levels within your cells. It's not important how much thyroid you have in your blood as it is how much active thyroid hormone you get in your cells. So your blood, you can do blood tests, and the blood tests 95% of the time are always going to fall in the normal range because that's how the lab determine what the normal range is.
But is it getting into your cells?
It's arbitrary. But the real question is it getting into your cells? If it's not, you're going to have the symptoms that we've described. And if you go to a conventional doctor, rather than giving you a therapeutic trial of thyroid medication, not synthetic thyroid, but desiccated thyroid, rather than doing that, he's going to put you on a host of psychotropic medications. He's going to give you antidepressants, anti-anxiety, sleep medication, give you anti-inflammatory medication, and any other headache medication, any other medication you put you on birth control pills if you're a woman, if you're having irregular cycles, you're going to be on a pot full of drugs. and you're not going to get better because the drugs are toxins in and of themselves and will make you more toxic than you already are, and further adversely affects your body's ability to utilize natural thyroid hormone, and you're going to remain sick, and you're going to get sicker quicker. I've seen it. Just saw it recently in my practice. Matter of fact, this morning, that's what I saw. And it was sad. The poor woman was on so many drugs, and she had all the side effects of these various drugs. They just keep giving her drugs. I mean, it was like, it's crazy. Who's the quacks? I mean, who gives people poison, one poison on top of another, thinking they're going to get them well, and they're not better. She sits there, and she is terribly debilitated.
Well, when you follow the money, and you said it yourself earlier in the program, that these pharmaceutical companies, once they had strung together some type of a diagnosis from a fake diagnosis from a cluster of symptoms, and they called it, okay, now we've got chronic fatigue syndrome, which never existed before, but all of a sudden we've got one, and their drug sales went from the millions to
the
billions. I'm sure they were giddy. Giddy. And they're not going to let that go.
And remember, what they do with their money, then the drug companies then go on TV and they inculcate into the public the whole concept that you can have a happy life if you take drugs, and drugs will solve your problems. Everybody that takes the drugs on TV are happy as a lark. I've never seen an unhappy person after they take the drugs. They smile, the dogs smile, everybody's happy, they bounce around. But they're bouncing around while the last 15 seconds of a 30-second commercial, they're listing all the deleterious, harmful, adverse, serious side effects of these drugs. And
many of them lead to death. And I think that Farxiga drug that's out is terrible. And as well, one of the side effects, could lead to, I think they said ketoacidosis, which could lead to death.
So, folks, you've got to do a 180 and take charge of your health. You've got to do that. If you don't do it, nobody else is. Your doctor's not going to take charge of your health. Your spouse is not going to take charge of your health. Your insurance company's not. Your employer's not. There's only one person that I know that can do anything about your health, and that's you. You've got to do a 180. Traveling down the wrong side of the freeway, yep, you're going to hit a truck. You're going to hit something coming your way. You got to turn around on the health freeway and go the right way and get yourself on a program that will enable you to obtain and maintain health and wellness naturally. You know what? I talk about this. I don't know why people aren't standing in line to get healthy and well. I just don't understand it. I mean, we got thousands and thousands of guests, but they ought to be just standing in line. And all the doctors ought to be standing in line and say, how do you get these results? We'll tell you how we get these results when we come back on the final segment.
That's right. And if you out there want to do a 180 and take charge of your health today, then give us a call at 281-698-8698. We would love to serve you. That's 281-698-8698. You are listening to Dr. Hotze's Wellness Revolution. Please stay tuned.
Dr. Stephen Hotze.
This is Dr. Hotze's Wellness Revolution, where we are on a mission to help you achieve health and wellness naturally. If you would like to do a 180 and take charge of your health, then give us a call today at 281-698-8698. That's 281-698-8698. Here's Dr. Hotze.
Thank you, Stacy. Thanks for joining us today on Wellness Revolution. We want to encourage you to do a 180. Take charge of your health. That's important because it's all you got. You lose your health, my friend, pretty much lost it all. No matter what you want to do in life, whether you want to build a business, build a great family, enjoy recreation, enjoy your weekends, enjoy your friends, if you're in poor health, you're not going to be able to do that. And you're going to end up being a burden on a bunch of other people when you could be a blessing to them. So why don't you just get your health back and get on path of health and wellness? Today, we've talked about a host of symptoms, a compilation of symptoms that people commonly have when they go see a physician in midlife, starting at about 35 to 40, both in males and females. It really predominates. About 6 times as many women experience the symptoms as men, and that has to do with the change in their female hormones that occurs on a monthly basis. Remember, men make sex hormone as well. That's testosterone, as you know. That doesn't have to balance out every month. A man makes it every day. He just has a slow and declining levels of testosterone over a lifetime. Some men lose their testosterone. It declines much more rapidly than others. And a lot of it has to do with their chemical exposure. So when we have these symptoms of fatigue, weight loss, or maybe an inability to thrive. I saw a guest of mine the other day, talked to him, and they had a 70-pound weight loss for no apparent reason.
Oh, my goodness.
They're in their 60s for no apparent reason over about 12 or 14-month period. Seeing his doctor in town, worked him up, could find nothing wrong, went to Mayo's Clinic. They worked him up, could find nothing wrong, but he's losing weight. Now, routinely, you don't think of that, and he was also terribly fatigued, couldn't think clearly, had all the classical signs and symptoms of low thyroid, except he had weight loss. And we normally think of people when they're low thyroid having weight gain because their metabolism is down. But there is a subset of individuals with low thyroid that have paradoxical weight loss. I think Catherine Ritchie, of course, who's been on our program before. And she had significant weight loss and was infertile at 28, was having no menstrual cycles. And when she got on thyroid, guess what? Everything perked up and worked well. She gained weight and looks good. I mean, they thought she was anorexic. You know, before we put her on thyroid, you would think, why would you put somebody who's anorexic on thyroid? But she had all the symptoms. And this gentleman I talked about has symptoms of low thyroid. So oftentimes people can have, not oftentimes, uncommonly, but it can occur that individuals that have low thyroid may have weight loss because their body isn't functioning well. But the symptoms classically we see with low thyroid are the fatigue, difficulty with weight, cold body temperature, maybe cold sensitivities, cold hands, cold feet, inability to focus, brain fog, poor sleep habits, mood swings, panic attacks, anxiety attacks, maybe depressed moods. Hair loss, joint muscle aches and pains, sluggish bowels, constipation, or maybe irritable bowels, recurrent infections. Women will get irregular menstrual cycles, infertility, inability to conceive or carry a term to pregnancy, carry a pregnancy to term. That can often happen, and we see that in individuals with low thyroid. So this is what I believe. I believe that anyone who has the symptoms of hypothyroidism deserves a therapeutic trial on natural thyroid, which is natural to the body. When you go into the doctor with these symptoms and then they have no blood tests don't show anything, they're going to put you on chemicals that never existed in your body never ran on them. They're going to put foreign chemicals into your body to try to change and make your body work better. That doesn't make sense. I don't need a double-blind study. I don't need evidence-based medicine. Chemicals that are toxins are not healthy to your system. You can't poison yourself to good health, folks. That's just the long and the short of it. You can't do that. And for the conventional medical doctors to buy into that, it's just crazy. You've got to replenish your body with the same identical molecules that your body produced in adequate amounts when you were younger. And that's what we do at the Hotze Health and Wellness Center. We approach you as an individual. We listen to your symptoms. We listen and look for your signs. We look at your past history, look at your family history. Based upon that, and with our experience with dealing with 30,000 guests, we know what the common problem is in most individuals, and that's hypothyroidism. I saw somebody derogatory said, well, you go there, they're going to put you on thyroid. Absolutely. If you've got the signs and symptoms of low thyroid, that's why people come into our office, because they haven't been diagnosed by another doctor. Well, they're just going to put you on thyroid. That's exactly what we're going to do. If you have the signs and symptoms of low thyroid, we're going to give you a therapeutic trial of thyroid rather than giving you an antidepressant or anti-anxiety or sleep medication. How hard is this to figure out? Put something natural in your body. I told you I believe that you need a health coach, a physician, and a staff of medical professionals who will coach you onto a path of health and wellness naturally so you enjoy a better quality of life without having to be placed on pharmaceutical drugs, which I know are not going to make you better. They're going to make you worse over time. They just do. They can't do anything but because they're poisons. They're toxins. I feel like I'm kind of getting on my soapbox about that, which I've been on for 20-something years. And, you know.
Well, you've seen it. You've seen people who've gotten on natural thyroid.
I believe in
not.
result-based medicine. When I have these people coming in on all these drugs and they're feeling sick and tired, we're their last resort, and we put them on a simple regimen and they get well, I'm going like, why in the world are all the doctors doing this? It's so simple. It's so safe and inexpensive compared to pharmaceutical drugs, co-pays, chronic illness, poor productivity, lost time with your family. Let me just ask you, when you're sick and tired and you're not feeling well, how's your relationship with your spouse? How's your relationship with your kids? How's your relationship with your fellow workmates or fellow members of your congregation or your friends or your family? You feel better or for worse? Do you enjoy it? No, you don't. So what have you got to do? You've got to take charge of your health. And I want to encourage you to do that. I want to encourage you today to give a call to one of our new guest coordinators, 281-698-8698, 281-698-8698. And they'll be glad to visit with you to see if you're a good fit for our program here.
That's right, Dr. Hotze. And something else that you mentioned as well is even for those of you out there who have been diagnosed with hypothyroidism, what do they typically give you? They typically give you Synthroid, which is artificial and is nowhere near as effective as natural thyroid. So it is very, very important to replenish your body with what it's missing. So again, all you need to do, it's so simple. Pick up the phone, have a conversation with one of our wellness consultants at 281-698-8698. That's 281-698-8698. And they'll also be more than happy to give you a copy of one of Dr. Hotze's books that explains in detail how you can do a 180 and take charge of your health. You can get the book Hypothyroidism, Health and Happiness, which lays out a lot of what Dr. Hotze talked about today. You can also get his second book, actually it's his third and latest book, Do a 180 and Join the Wellness Revolution. Both are excellent books. It will help educate you on what you need to do to get on a path of health and wellness. So great to have you join us today, everyone. It's been a pleasure. Have a blessed day.
Information provided on this radio program is neither intended nor implied to be a substitute for professional medical advice and is not intended to replace the services of a physician, nor does it constitute a doctor-patient relationship. You should not use information from this radio program to diagnose or treat a health problem or disease without consulting with a qualified healthcare provider. If you have or suspect you have an urgent medical problem, promptly contact a professional healthcare provider or call 911. Dr. Hotze's Wellness Revolution radio program advises you to always seek the advice of a physician or other qualified health provider prior to starting any new treatment or with any questions you may have regarding a medical condition. Any application of the recommendations from this radio program is at the listener